And thank you all for being here. Thank you especially to our hosts for opening their home to us today. My name is Julie Tapp. I'm a local organizer here in Orange County, California, and am very excited to be here today to have a conversation about healthcare with Congresswoman Katie Porter. As you all know, we are all affected by healthcare, whether it's the cost of our premiums, our medications, our ability to find and get in with a specialist if we need one. And so that is why I'm especially proud and honored to be here with our member of Congress who really has been fighting very hard since day one on behalf of us, her constituents, on many issues, including the affordability and accessibility of healthcare. So with that, I will just turn it to you, Congresswoman Porter, with an opening statement, and then we'll start talking.
Wonderful. Thank you, everyone, for being here. Healthcare is one of the most important issues in our area and most important issues in the country. And I've had over 12 town halls here in the 45th District, and this is the single most important issue that comes up. And it's so deeply personal for all of us because we care about the well-being of our kids, of our parents, and wanting to take care of ourselves so we can enjoy our lives. So I've been working very hard in Congress, focusing on a couple of key priorities. Top of the order, most important thing, reducing the price of prescription drugs. And so we've passed in the House H.R. 3, the Lowering Prescription Drug Costs Now bill, which would help those with allow Medicare and Medicaid to negotiate drug prices, but it would also importantly allow those with private insurance to take advantage of those reduced drug costs. I've also been doing a lot of work on accessibility and affordability of mental health care. So the Affordable Care Act promised parity between mental health and physical health, and yet anyone in our community who has tried to obtain mental health care knows that we face a shortage of providers, difficulty with reimbursement rates, and long battles with insurance companies to get coverage. So we are lucky in the 45th District to have high-quality healthcare providers. We have some wonderful research institutions and some wonderful hospitals and doctors and networks, nurses, a great team of providers, but they're struggling to get care to us, and we're struggling to take advantage of that great health care. And so I'm grateful for the opportunity to be here today to hear your stories and to be able to share with you what we can do in Washington together to bring down the costs of health care and make sure that every American has access to high-quality, affordable treatment.
Thank you so much, Congresswoman. Let's get started then. I think Kathleen, do you want to share first?
Sure. Thank you. Good morning. I was so excited when the Affordable Care Act came because it meant for me that I have a pre-existing condition that I didn't have to be a captured employee anymore. And it came at a really good time because my late husband was going through like his final phases of multiple sclerosis. So he needed somebody to take care of him 24/7. And I couldn't afford to hire someone to be there with him 40 hours a week. So I was able to leave my job, start some consulting from home, and then care for him in his last years of life. As my company has grown now, and I have a business partner, still work at home, and I'm still able to buy my own health care, I'm concerned that pre-existing condition clauses and protections for us are going to go away. And I keep thinking in the back of my head, am I going to have to go in the last 8 years of working before my retirement, go get another job just to get the insurance?
Yeah.
But I appreciate everything you're doing in fighting for us.
Well, thank you for your story, and I'm sorry for your loss with your husband. And one of the things that your story highlights, it really is two stories. It's a story about the need to support families who are providing end-of-life care and the challenges in finding care providers and affording home care and getting that home health care help, and also recognizing the hard work that those workers do in providing home health care. But also your story about pre-existing conditions is a powerful reminder of the fact that in our country, healthcare is inextricably intertwined with economic opportunity and with job opportunity. And so we see so many people who say, I really want to start my own business, or I really want to take those couple years and step out of the workplace and be with my child, be with a partner at the end of life, take care of an aging parent, but I can't because I won't have the ability to get healthcare. So your story is a reminder of why protections for pre-existing conditions matter. And I am all in making sure that we never go back to the system that we had of preventing people with pre-existing conditions. And one reminder is that pre-existing conditions are not something that there's a firm definition of. Insurance companies control what is and is not a pre-existing condition, often in ways that fall particularly on certain kinds of communities, on women, of people of color, on certain kinds of communities who may be more predisposed to have certain kinds of diseases or conditions. So we need to absolutely protect people with pre-existing conditions. And right here in our own district, 330 plus thousand people have pre-existing conditions. So it's a huge number of people. It's not a dozen, it's not a few hundred, it's not a few thousand, it's hundreds and hundreds of thousands of people who are benefited from this important change that we made in the Affordable Care Act. And so thank you for sharing your story. Again, I'm sorry for you about the loss of your husband, but I'm grateful that you've been able, because of the Affordable Care Act, to find work that you can do that allowed you to be there with your husband, but also be able to have health care for yourself and to keep that care going forward as your business grows.
Thank you so much. And I share that concern about pre-existing conditions, as I know we all do. It wasn't long ago that, you know, that was a real concern for people. It still is, from what it sounds like. My firstborn was almost a pre-existing condition, and I think women are particularly affected by that policy. Letitia, do you want to share your story?
So speaking of women being adversely impacted by healthcare, years ago I was going through a divorce and really grappled with thinking about leaving or moving because my health insurance was tied to my job, of course, and just thinking about being a single parent and the head of household, I didn't think I could afford to lose my health insurance, being primarily in charge of the care of my children. And so I want to know, and I'm someone who has a college degree. I knew I would eventually get on my feet and find another job with health insurance, but people not like me who are really tied to health insurance and maintaining stable employment, I worry about those and accessible, affordable, quality health care that's not directly tied to employment. And so I'm wanting to make sure that any changes that we see give us a little more freedom to get access to health care without direct ties to employment.
Yeah, and Letitia and I have in common that we're both single mothers of young kids, and we're both in elected office. And it's a very small club,
Yes,
so
you're right.
you're looking at a big chunk of the club nationally here. And so, you know, I too went through a divorce, and this was a challenge in my divorce. It's a challenge in a lot of people's lives. It's a challenge for kids who want to move out and get on with their lives, and parents who would like their couches back. But the children are worried about whether they can get employment with health care. But we do see the way in which this leaves people in situations, sometimes in abusive situations, because they cannot or are worried about being able to find and afford health care if they leave their partner. And so it's another way in which, because it's tied to employment, those who are married, who are in a couple or a partnership, they essentially have two options for health care. They can get it through themselves or they can get it through their partner. If you're a single parent, it's on you, which makes the fact that single parents also are more likely to experience job instability and changes in employment, more likely to have to take time out of the workplace to care for kids. It's really a double down on that phenomenon, which makes having that backstop of being able to go into the insurance marketplace with the Affordable Care Act and get that coverage more important. I'll also just say that it's economically tough to be a single parent, which is why the costs of health care are so important. And so I think one of the debates that we have is we all understand the way that the Affordable Care Act expanded access to coverage, and we champion that. We celebrate that it protects people with pre-existing conditions, that it does give someone like you an option when they're changing their family circumstances. But that doesn't necessarily make it affordable. And that is a hurdle that we need to squarely own as we talk about how can we improve from where we left off in the affordable health care. And we've had to defend the Affordable Care Act a lot, but we also have to be clear that it didn't accomplish everything that we wanted it to, and there's more work to be done, including on the affordability piece.
Thank you.
Clarice, do you want to add to that?
Yes. My mother died of ovarian cancer when my sister and I were teenagers. And as a result, my sister's had many mental health issues involving anorexia and bulimia over the years. And Mental health parity is really a problem. Also, the stigmatized of mental health issues, also a problem. But even though we have mental health parity, what can we do to actually have it? And it's really a big issue beyond the issues of, pre-existing condition and everything else that we've sort of addressed in the ACA. It's a big problem.
One of the things I used to like to say, and I think it's very apt here, is as a consumer protection lawyer, it doesn't do any good to have a right that doesn't exist in reality. And this is where we are with mental health coverage. So we have a right to mental health parity in the Affordable Care Act, but in reality, we're not enjoying the ability to get mental health services. And this affects not only patients, but also employers who strain to pay premiums, and they choose plans that have mental health coverage because employees have told them, this is important, I need this for my family, I need this to be a productive employee. And yet what they hear back is that when they go to get mental health coverage, there are no providers. Providers are not taking any new patients. The wait list is 3 to 6 months. And by the way, everybody's out of network. And so what we see is people who are shopping for healthcare plans, trying to be good consumers, trying to choose a plan that will provide that mental health coverage, but then when they go to get the benefits, there are none. And so this is an issue that is about how we compensate mental health care providers, that we recognize the work that they do, the cost-saving work, the life-saving work that they do. It's an issue about how we police insurance companies. And so I have a bill called the Mental Health Parity Compliance Act. And it's a bipartisan bill, and I'm pleased that we have bipartisan cooperation on this issue. That what it would do is make sure that we're auditing insurance companies, so when they say they have mental health providers in their network, that they actually do. And so it would direct the Department of Health and Human Services to conduct those audits and make sure that network coverage for mental health is actually there. But just yesterday, I met with some of our folks from the Children's Hospital of Orange County, somebody who works with the county providing mental health services, to talk about the need to also train additional providers in this area. And so making sure that we have enough providers and then reimbursing those providers such that they take insurance, because that is a real challenge. And so there are a lot of people, and I think, Florice, you know this well, is that when you have a mental health problem in your family, no matter how good your insurance is, you're often going to face out-of-pocket costs of $5,000, $10,000, $15,000, $20,000. And somewhat ironically, if that loved one ends up in an inpatient hospital unit that is an acute crisis, the insurance company will step in. But they weren't willing to pay to get that outpatient care. And so one of the things we're so lucky at the Children's Hospital of Orange County that they have an intensive outpatient program, which is wonderful. It's incredibly effective. They also have a partial inpatient program where teenagers are there for part of the day and then go back home in the afternoon and evening. And so it's an integrated care designed to provide that bridge and that transition, designed to keep people from having to be admitted. And insurance companies won't cover those kinds of care. And so that is not parity, and that is what the fight that we have to be in for. So even as we're defending the Affordable Care Act, we have to be clear about the places where it came up short. And the stories of your sisters, and the stories that I hear from kids all around this country and grown-ups. And also we're facing a crisis in geriatric mental health care. We have a generation of people who have had access because of reduced stigma to mental health care, but as they age and go into the Medicare system, does Medicare have the number of providers that it's going to need to be able to provide that care for patients?
Wow, there's so much to learn. I've learned so much in hearing you talk about this issue. Thank you for sharing about chalk and just the supply side. I know you had brought that up before, that it's not just that there aren't enough people providing these services, but the reason that that's happening, it's not just a sort of supply and demand, simple, straightforward thing, right? It has to do with the reimbursement rates and as well as stigma, but really more about the marketplace for mental health care services. Dr. Bill, did you want to jump in here?
Thank you. I'm Bill Honigman. I'm recently retired after 35 plus years of a career in emergency medicine, primarily here in Orange County that I practiced. And my concern, I'm really glad you're working on mental health issues because, as the ER, as we say in the ER, we're kind of the court of last resort. That's where people end up. And so oftentimes they would end up with mental health issues that weren't being addressed through the system otherwise. But I have even more concern about people who are still yet even uninsured or underinsured and end up in our ERs. And I can tell you on a daily or nightly basis, because I work night shifts, that people would show up with heart attacks and strokes, and you would have to wonder, were they getting the preventive care that they needed to avoid those conditions? People with untreated dental infections were showing up with serious life-threatening infections. And then I have to tell you, it's still an embarrassment to me that they would come in, I would propose a test or a treatment, and next thing I knew, they were walking out because they knew they couldn't afford it. So what can we do still to get all the people, all the care that they need?
So I think this goes to 2 points. One is about expanding coverage, and whether we do that through moving toward a Medicare for All type system, or whether we do that through figuring out how do we get the remaining people who didn't get picked up by the Affordable Care Act to get picked up. Part of that is Medicaid expansion in some states who didn't do it. We're seeing some red states who are now willing to understand that Medicaid expansion really will help with that. But it's also about affordability. So your point about being underinsured is one that I want to pick up on. And so, as a consumer advocate, sort of I read the fine print. I try to look at the copays. I try to think about it. I had good insurance in my prior employer. I have Affordable Care Act insurance now as a member of Congress. That's something a lot of people don't know. We have Affordable Care Act insurance. And so I really shopped for a plan when I became a member of Congress. And I was given 64 choices, which was extremely overwhelming. I spent a lot of time trying, and I thought I'd found the right plan for my family, for my 3 kids, given that they were going to be living here and I was going to fly back and forth to DC, and factoring in the different kinds of medication and what's covered, and the different kinds of providers and what's covered, and is my kid's pediatrician in network. I got all the way to the end when I almost signed up, and then I noticed that the out-of-network maximum, or the out-of-network deductible, was something like $30,000. I don't have, so this is what's happening to people. And then most of the mental health coverage, for instance, if that we needed that, would end up being out of network, right? And so lots of people who have insurance, but that out-of-pocket maximum is completely out of reach, right? And even the deductible is a stretch for a lot of families. So if you have a healthcare plan with a $2,000 or $3,000 or $4,000 deductible, do you have that money at the ready? And in a high cost of living area like ours, people don't. The other thing I want to say is about your point about the people who delay treatment, people who walk out because they can't afford it, prescriptions that go unfilled. We know every year people get prescriptions. The doctor says, "Now you'll take this, right?" And the person says, "Yes." And they're thinking, "Yeah, I'd take it if I could ever afford to fill it." But they don't want to have that conversation with their physician. But even if they do, there's very limited things that you as a provider could do in those situations. And so the costs of people delaying care, or we're not going in and getting treated, they ultimately wind up needing the most high-cost kinds of care, which is ER care, it's emergency care, it's untreated chronic conditions, whether it's the cost of insulin causing people to share a prescription for insulin, resulting in unmanaged diabetes or less than optimally managed diabetes. All of that ultimately ends up costing us more, and in some cases ends up putting people into a situation of being permanently or partially or temporarily disabled, meaning that they're out of the workforce and they're needing that support to be able to make ends meet. So we have to start thinking about healthcare as an investment in our collective community, an investment in our workforce, an investment in our young people. And so there's a lot of ways to talk about healthcare. There's the sort of moral imperative to not allow others to suffer, but there's also a strong economic argument for why universal affordable coverage, not just universal coverage, but universal affordable coverage, because healthcare that, a prescription that you can't afford is really no prescription at all. And I think that's something that is a reality in a lot of people's lives.
Hi, Congresswoman. I'm Lauren Johnson Norris, and I want to share with you my story, which is that in 2009, when I left county government to start my own business, I finished my COBRA and found that I was uninsurable due to a pre-existing condition. I was very fortunate as an attorney to find a bar association that had an HMO that I could pay $500 a month for. The following year, my husband went to UCI, went back to school, and he also got insurance, and we jumped on that plan too. And it was a good thing because I gave birth to twin girls shortly thereafter. I didn't expect to be in the hospital for over a month through preterm labor, and I didn't expect that my girls would be in the NICU for about a month. But it was a good thing I was insured double, because when we got the final medical bills, it was over $1 million. Wow. And for other families who might find themselves with their newborn children in that situation, or a mom in that situation, that's beyond just bankrupting you. I mean, that's a debt for life. So how can we make sure that these costs are not $1 million to have children in America?
Yeah. No, thank you for sharing your story. And I'm so glad that your girls are well and flourishing and full of energy now. But, you know, your story that you're telling about healthcare bankrupting people, and it's long before it gets to $1 million for most people that it would be a bankrupting thing. So I used to study bankruptcy law. I used to help do some of the research that we rely on to show how many bankruptcies in this country are related to illness or injury. And one of the points about it is, yes, there are uninsured people who wind up in bankruptcy, but the biggest group of people with medical bankruptcies are people who have insurance, but that insurance is inadequate. It's that out-of-pocket maximum, it's that lifetime maximum cap, it's things like that that they run into. And the reality is, none of us can underwrite personally. You cannot save, well, maybe Michael Bloomberg, but nobody else can save for a premature child. That just isn't something that we can save for. You just can't put away enough pennies for long-term cancer treatment. And that is exactly the purpose of insurance. So we have to make sure that it's really there for these kinds of unexpected expenses. And one of the things I'm really interested in is, and I had this experience when I was having my kids, is when you're pregnant, you go to the doctor a lot. They like to take your temperature. They like to listen to your heart. They like to poke and prod you. And so I have never had so many doctor's appointments in my life as when I was pregnant. Well, if you go to the doctor 20, 10, 15 times during a pregnancy, if your doctor's any good, they'll find something wrong with you. And so all along the way, that creates a pre-existing condition on top of the pregnancy. So whether it's you flunked a test for gestational diabetes, which is a very high false positive rate, even if you ultimately don't have it, those kinds of things can be held against you. But your story about the size of that medical bill and the need to have double insurance to even begin to cover it is really, really powerful. And I'm grateful that your girls are well, but the stress that you and Craig went through at a time in which you're just trying to make sure that you're healthy and that your little girls thrive and are able to come out of the hospital, to have to be thinking that entire time about how are we going to pay for this and are we going to be able to afford this, and dealing with insurance companies. I mean, that's something I hear from both providers and patients. I don't want my healthcare to be about fine print. I want my healthcare to be about well-being. And so that is something that I hear from really routinely from both providers and patients. And I think it's a big challenge in how we think about improving our healthcare system going forward.
And that's such a common story too. And I think sometimes I wonder if it's just a lack of imagination. We're so used to the healthcare, these issues that we have. I don't know, I just think it's hard to imagine having a healthcare system where we didn't have to worry about changing jobs or, how big the bill is going to be that we won't be able to pay, right? I want to kick it over to Betty Valencia. Do you have a comment?
Yes, thank you. Congresswoman, I have a story to share with you, and I think about pre-existing conditions, and I think about uninsured or underinsured. And one of the things I want to share with you is how it impacts extended family, right? So I have good health insurance. Unfortunately, my brother didn't. Oftentimes, he had to pass up a lot of the medication he had to take for a terminal illness. Now with the ACA, I feel like he's given a chance to live at least a sustainable life. Part of it is he finally was able to get his knee completely reconstructed, which he waited over 15 years for, meaning that he can actually get up and go out and look for a job. Now, I fear that if we go back back, that will end his life essentially. So it is a matter of life and death in these kinds of instances, and then also the hardship of extended families. So I look forward to helping and working in whatever manner. My question to you is, how can I help as a constituent? Where I'm at, what can we do to make sure that we don't go back? Because this essentially is going to impact all of us, whether we're directly with the CA or not. We need to be moving forward. And so everything you have mentioned seems like we're progressing. I just need to know, what can I do to help you, to help us?
Yeah. Well, part of what you're doing is sharing your story today and continuing to talk about the way in which the Affordable Care Act really improved your brother's life and gave him the ability to earn and to be independent, and allowed you to focus on your life. But part of it is also really educating yourself on where elected officials stand on this. We have a Republican Party that has voted repeatedly and pledged repeatedly to repeal the Affordable Care Act, and they have offered nothing in return. And so people need to kind of see through the flashy conversation and really look at where the policies are. And the Democrats have passed bills this year to defend the Affordable Care Act, to protect people with pre-existing conditions, to lower health care now with H.R. 3. And then I think ask your representatives, ask folks like me, what are you going to be doing tomorrow? So I've talked about the mental health parity bill I have. One of the things I was really excited about with the H.R. 3, the prescription drug pricing, is we were able to get an amendment that would return tax dollars back to our healthcare system that could be used for research or education or covering additional people, providing dental coverage, all those things, because we were able to say, if you gouge consumers, if you have triple-digit price increases in pharmaceuticals, we're going to make sure that the money gets returned back to the system. So I think speaking up, voting, understanding that we are all healthcare voters. This is an issue that's personal for us, and we should think about it when we go to cast our ballots.
Well, and healthcare issues affect all of us. It's not, disease is nonpartisan, right? So we are all, so many people that I've talked to in my work in the community have shared that as really their top concern. Marianne, I would love to hear from you, speaking of, your family being affected.
Sure.
Would you like to chime in?
Hi, my name is Marianne Shin, and this is my brother, Jim Shin. I'm his guardian as well as caregiver. My brother has cerebral palsy, and he's been on a fixed income, but 12 years ago he got a job. He got a job at Disneyland, but it's not, it's a part-time job, it's minimum wage, and he doesn't get any additional benefits. But as a result of that job, he lost a lot of his, he lost additional services. And so he was priced out of his home, and he's really worried that that if he loses the Affordable Care Act, then he won't have insurance. So what can you do for people like my brother, I guess? He's concerned because that little bit of money that he's earning has essentially withdrawn a lot of the care he's getting.
Yeah. No, thank you for being here, both of you, and thank you for your hard work and sharing your story. I think this is one of the issues that we face is people who are trying they're reconfiguring so many aspects of their lives around healthcare. So here's someone who was able to get a job and enjoyed his work, and yet it ended up meaning that his healthcare situation worsened, which then puts him at jeopardy of losing that very job. And so like I said, I really think we have to reframe this conversation around an investment in each other, around what it means to have healthy, long-term, consistent care. And when we have people getting services and then losing services, getting a provider and then being told that provider's out of network, all of that creates gaps in care and coverage, which ultimately, particularly if you have a long-term degenerative condition, means that you're worsening your prospects. And so, thank you for being here. Thank you for sharing your story.
I want to thank you, Representative Porter, for being an advocate, not just for consumers, because that's, as you mentioned, a very huge piece of what we're looking at nationally at this point in time, but also to those of us that are providers. I want to thank the doctor for your frontline service. My nurse's hat is off to you. I came up through working my way through nursing school. I saw managed care move in and basically mow down private sector, I've worked private sector, I've worked federal sector. One of the things that's come up recently are insurance carve-outs. And even as recently as this week and today, there's stories of where people go into the hospital. As you mentioned, the doctor finds things that need further attention. They get seen by a specialist. They get discharged from the hospital, presuming that they have insurance that has done a wonderful job of covering this. Except for that plan doesn't cover this provider. Mm-hmm. I am very fortunate as a retired registered nurse to have a private plan that comes with a cost, but I've also recently become eligible for Medicare. And I deliberately decided to keep both plans because I don't want to end up in that situation where, oops, now I don't have any coverage. Mm-hmm. So this is sort of a dual question because we really need to look at those carve-outs. We've talked a lot about that at this point in time, but we also need to take a look at what moves forward. And again, part of the reason I've kept both plans is because there's been a lot of debate about keeping a private plan, Medicare for all, fixing the ACA. Where are we going with this?
Yeah. So one of the places we're going is having conversations like this, where we really begin to have this debate. And so when I heard when Dr. Bill talk about sort of waiting for months and months to get treatment, people waiting, for 15 years, you said, Betty, to get a knee replacement. When we say, well, if we had a Medicare for all system, we would have wait times. Betty's brother waited 15 years because of affordability, right? And so the wait times don't just come from bureaucracy. Wait times come from the lack of affordable care. And that's a big part of when we have these conversations about what would cause wait times. We have to recognize that right now, today in America, people are waiting. And they're going without health care. And that is a function of the affordability crisis that comes from inadequate coverage, from insurance denials of claims. I myself was surprised, Bill. Many of you have heard this story. My appendix burst on the campaign trail. It really hurt. It actually feels better, weirdly, after it bursts. But I chose to go to an in-network hospital. I knew which hospital was in-network. I chose to go to one. I saw a doctor. I waited a while, I got taken up to the ER, and the doctor said, no problem, I do 1 million of these a day. In the OR, I do a lot of these, it's no big deal. Turned out it had burst, they didn't know that. And I was in the hospital for a week. I got really expensive antibiotics, thousands of dollars of antibiotics. I was shocked at how much they cost to prevent me from getting life-threatening sepsis. But when I got out, the hospital bill was small. My insurance had covered it. And I remember just breathing this huge sigh of relief that I dreaded opening that envelope. I mean, how many of you get a bill from your statement of benefits or an explanation of benefits and you just dread opening that envelope, right? And so I opened it, it was covered, and I thought, oh my gosh, my insurance worked. And then a week later, I got a bill from the surgeon for $3,000, give or take, for the pre-care, the surgery, the post-op, the in-hospital care. He'd done a lot of work. And enclosed in the bill was an instruction sheet that told me how to appeal the denial of coverage, because that surgeon was out of network, even though I'd gone to an in-network hospital. So when you're on the OR, as the anesthesiologist is trying to prep you and you're getting ready, they tell you to count back to 10, 9. Are you supposed to say 10? Are you covered by my plan? 9, 8. And truthfully, providers can't even keep track of who all they're covered by. You might rattle off your name of your insurance company and they don't even know. And so this surprise billing problem is a huge one. The fact that my surgeon, instead of dedicating his time to the practice of saving lives, is spending time having an entire department of his office dedicated to helping people battle insurance companies really reveals how broken our healthcare system is. And as a nurse, when you go in to take patients' temperatures or check on their vitals, they'll often ask you about the bill. How much is this going to cost? Do I really need that? Right? Because they're just worried about it the entire time that they're in the hospital and the entire period of out-of-hospital recovery.
So there's so many issues. It's great to have this conversation. Deanna, do you want to jump in?
Hola, mi nombre es Diana Nufio. Soy madre soltera de 3 hijos. Soy una recamarera. Trabajo en Irvine y vivo en Irvine. Soy inmigrante guatemalteca y tengo medical. Yo estoy ahorita teniendo problemas de salud mental con mi hijo de 13 años y no está accesible al sistema médico. Yo quiero preguntarle qué es lo que usted puede hacer para que nosotros tengamos más accesibilidad al sistema de salud y también por la barrera del idioma que tenemos. Gracias.
I'll translate for her. My name is Diana Nufio, and I'm an immigrant from Guatemala. I'm a single mother of 3 children, and I live and work in the city of Irvine, and I have Medi-Cal. And I'm currently having issues with my 13-year-old son who has mental health issues. And so my question to you, Congresswoman, is how could you help make sure that mental health and medical access is available to someone like me?
Thank you very much for sharing your story. And I've talked a little bit about the need for pediatric mental health coverage. Let me sort of tell you where we sit here today in Orange County. We are one of the 10 largest counties by population in the United States. And yet, until a year ago, if someone like your son, when he was 12, if he had a mental health crisis and needed acute care, his only options for treatment were San Diego or UCLA. There was no inpatient care available in Orange County. So our Children's Hospital has expanded their mental health services, but they will tell you that they spend a lot of their time fighting with insurance companies. And so that intensive outpatient, that partial outpatient program and that intensive outpatient program, those things are not covered by Medi-Cal. And so that's something that we need to be in conversation with our state partners. So Medi-Cal is a block grant program. The federal government makes a block grant to each state to provide Medicaid services. Our program is called Medi-Cal. But the federal government also has to hold states accountable, making sure that when states design and administer their Medicaid programs, that they're doing right by patients with mental health conditions, that they're doing right by patients, that they're not designing Medicaid programs that essentially leave people with minimal coverage. And so this is a federal-state partnership issue in terms of making sure that the state is fully funding Medi-Cal in a way that you're getting the coverage that you need. And so there's a role for the federal government here, not just to fund Medicaid programs, but also to make sure that states are doing right by patients and how they deliver them.
Thank you so much. Nancy, do you want to jump in here? I know that our time is getting a little bit short, so I want to make sure we hear from everyone who wants to share. Go ahead, Nancy Colacino.
Certainly, thank you. To make this brief, in 2009, before 2009, we had great insurance, but then when our daughter turned 18 and graduated from high school, she was no longer eligible to continue on our coverage because she couldn't keep up with the 12 hours of full-time residence coursework. So consequently, she failed classes. It sort of boomeranged into a whole bunch of things where we had to buy really expensive insurance, and we're just sort of hanging on until the Affordable Care Act came, and that really was a savior for her and for us in terms of help. It took a while. It took a long time. She received help from NAMI, from the National Alliance of Mental Health, and also there was a Goodwill job training program. And today she's 28, and she's now, they were able to help her focus in on her passion, caring for animals, and she's working almost full-time. So now the problem is she's making just enough that she may be over the Medi-Cal limit, and yet not ready to support herself and pay her own, all of those expenses. So it's just that those protections and those social support programs for our young adults are so important, and the repairing the damage takes years, where a little bit of prevention, well coordinated, would have been the solution. So I would just encourage us, when we think about this, to think in a broad way about prevention.
Thank you so much. And I think one of the things your story illustrates, and it echoes what we've heard, is that we have this patchwork of coverage. We have people who have multiple insurances because they're worried that one won't get it done. We have people who fall off a cliff with one program, and it can take months and months to get picked back up. I think this is one of the things, as we talk about which direction should we move, one of the advantages of Medicare for All potentially is that it eliminates that constant shifting, the gaps in coverage. There is no health insurance company that has the broad coverage of Medicare in terms of number of providers. So when we talk about how important it is for most of us to keep our physician, that's really what we care about. We don't care about keeping our insurer, we care about keeping our providers. And Medicare has the broadest number of providers that take Medicare. There's no one better than that. It isn't to say we don't have to work, though, on some areas like mental health. So I think the fact that you see people who are thriving and who are succeeding, and yet the consequences of that can be to move forward economically, can be to move backwards in terms of the health care that they're receiving. That's a broken healthcare system.
For sure. Okay, so we have time for a couple more questions. We'll go for Erica and then to John.
I actually just wanted to share my story about my son and why, especially I know we've talked about keeping pre-existing condition coverage in place, but why it's so important to me, and it is kind of similar to Lauren's. When my now 4-year-old son was born, he developed a really nasty infection when he was about 2 days old. We were literally like 5 minutes away from getting out of the hospital, and I was like, can someone come take a look at this? And next thing I knew, the room was full of doctors. And over the 2 weeks that he was in the hospital, every doctor, every nurse would make jokes about, well, it's a good thing that there's coverage in place, or you don't have to worry about pre-existing conditions. And I remember I'd be like, heh, heh, heh. And then in my head, I was thinking, it's not funny, it's terrifying as a parent. Especially as a new parent, it's not like my son did anything. His umbilical stump got infected. Who knows why it happened, but it's terrifying to know that that is on record at the insurance company. I've had doctors who I've never mentioned it before. They're like, oh, I pulled up like his old records and can we talk about this? And it's really scary. He's 4 now. He's obviously on my insurance through my work, or my husband has insurance. But that might not be the case. When he ages out, he needs to get his own coverage. That might not be a choice for him.
Yeah. No, and when you think about someone that being born, coming into this world with being handicapped for your entire life, from being able to get care, to have job freedom, to have the flexibility to start your own business, I think it really drives home that literally the act of coming into this world can be a pre-existing condition. That's something that we should all stand against, because it's just holding back our future generation. And I think we all feel too that it's morally wrong. We should care for our most vulnerable and give them the best footing and best opportunities that we can.
Very good to meet you, Congresswoman. Very proud to have voted for you in 2 primaries and soon a general again, so can't wait. In 2015, I suffered a psychotic break, and I wasn't making much sense, and so my family stopped answering their phone. I got fired from 2 jobs as a massage therapist, and was homeless within about 2 months. What can we do to design a system where someone like that, who finds themselves with no one and nothing, doesn't end up alone and terrified and stigmatized and unable to get help?
Yeah. No, thank you for sharing your story. And it's really one of the things that you're doing that's so important is by sharing your story, you're helping to lift that stigma. And a lot of us in our lives, but for the grace of God, go so many of us. And I'm really delighted that you're here and that you're speaking up. It's really powerful and it's really moving. And so thank you for being a voice for people who are going to go through those kinds of situations. I think one of the issues here is that part of the reason that that there is not the caregivers that we need to have in those kinds of situations. And so you might wind up in an ER when you suffer that kind of situation. The ER doctor really wants to help, but they're given 3 days. And so you're going to come out of that ER, you may be restrained for those 3 days, you'll come out with no diagnosis, no prognosis, no wraparound services, and you're told to go find a psychiatrist, which if you can call and call and call and call, and you could be months till you get an appointment. So one of the things that we're seeing our VA do, that I would like to see us move into the model of doing more and more with other insurance, is integrated physical and mental health care. And so the VA in Long Beach, for example, has a separate ER for patients that are experiencing acute mental health situations. And so it's designed to recognize and provide those wraparound services. But for somebody like you know, this cascaded in a way that ended up being very, very painful for you. Very painful for your family, who I'm sure felt powerless to help you, and very, very isolating. So I'm really proud of you for sharing your story. I'm really grateful that you're well, and I'm going to be partnering with you in this fight to make sure that people don't have to go through what you went through.
Thank you.
Thank you so much. Thank all of you so much for sharing your stories. It's fascinating. I'm so sorry we don't have time for more, but just so interesting to see the common threads that are here, and just how unique at the same time each person's story is. So I know some of us are on one side of the aisle, some are independent voters, some are on another side of the aisle, but I think we all have this in common, that these issues affect all of us, and we are so grateful for your time and your leadership and the fight that you bring to your job. Thank you so much, Congressman Porter, for your time today.
Thank you. Thank you, everyone.